The dosage should be 3 to 5 ml. Then you need to also repeat it 7 days afterwards. You are welcome to our first session on actual demonstration. So this is iron injection. So injectable iron solution, you can see it here. And it's just a 10% of iron destron. And so if you go to buy any medicine from any veterinary shop, or if a veterinary brings a medicine to you, the first thing you're supposed to look at is to look and see that the animals you want to use to treat, you have that animal listed in the animals for which the drug is made. And if you look at this one, this iron here, it can be used in treating goats, sheep, dogs, pigs, piglets, as well as calves and even horses. So it means if you are looking at a pig farming aspect, you have yours covered in this drug. After you have seen the animals for which you want to use this iron in, the next thing is also to check on the drug to see the expiry date. The expiry date is very important. You don't have to buy a drug and get to your farm only to find out that the drug has already expired and you need to return it. So you also check for the expiry date. In this case, you can see that it will be expiring in somewhere January, yes, January 2027, about 3 years from now. It's not bad. So this one you can keep it. If your pigs are not plenty, you can even use it several times, even maybe for a year before it gets finished. Alright, so after you've also seen it, now let's talk about why you need iron in your animals. Let's say pigs. One thing about giving iron is that most of the time we only advise you to give iron to the piglets, that is young pigs, once they have been given birth to. So with that, usually we say give it to them as early as possible in the first week. That is after 2 days to 6 days after giving birth. But in this, we always say give it to them on the third day. And on the third day, because after the third day, you already know how your animals are doing, and they even have this solid body. They look a bit active, and from there you can even know what those that will be surviving on the third day. And the skins are already dried enough for you to handle them. So after you have gotten it, if you look at this drug, as we used to say, it's for piglet, or you only use it to treat piglet. It's not always about piglet. You can use the drug to treat. You can use to treat pigs as well, like in general, whether growers, finishers, the breeding sows, and then the boars. You can use this same iron to treat all of them. And looking at this, we have two aspects of it. We have iron as a treatment and iron as a preventive measure. So there's a difference between treatment. If you buy it and look at the treatment and prevention, there's a difference between them. Treatment means that it has already occurred. You know iron. If you don't have iron in your system, you are likely going to run into anemia. So anemia means you have loss of blood. Your blood is not adequate to help distribute the nutrients you need in your system. So the blood carrying capacity will be low. So if you say to yourself that you are not going to treat your piglet, but they will do well, fine. And it gets to the time you realize that your piglets are not doing well, or your pigs are not doing well again, and there's the need for you to go and give this iron. That is, you have already seen anemia in them, and you have seen how their skins have started fading in color. In that case, you are treating, you are not preventing. But if you want to prevent, that is, it has not happened yet, and you are taking the measure so that it doesn't even occur at all on the farm. That is why we always recommend you to treat the piglets on the third day after they have been given birth to. So looking at this one, if you're going to use it for treatment, maybe you have now realized that your pigs are suffering from anemia, or the veterinary has come to confirm for you that your pigs are anemic and they need to be given some sort of iron in their system. That's why you're going to treat it or treat them at this point. So with the treatment, if you're giving to pigs, that is not piglet to pigs, the dosage should be 3 to 5 ml. Always read on the labels, you see them there indicated. Then you need to also repeat it 7 days afterwards. After the first dosage or first administration, you need to give it to them on the 7th day again. That is, if you give it to them today, Monday, the following week, Monday, you have to get your animals and give it to them again. That is to prevent, that is used to treat the animals now, because you couldn't prevent it. But if it is a piglet, there are some piglet, the moment they are just born, they are anemic already. You can see them from the skin, they look that kind of white, and you can see that definitely the animals are not with enough iron on blood circulation in them. So that one, they are just born anemic. And this one can also result from their mother. Maybe you didn't treat the mother well, and then the mother went through a lot of stress, no food, the right nutrients were not there. So she couldn't give enough of these ions and the necessary nutrients to the piglets. So they are born anemic. If that is the case, you have to treat the piglets. You are not preventing anything, you are treating them out of anemia. So if you want to treat the piglets, you give it to them 1 to 2 ml Okay, if it's piglets, they are born without enough blood, or they are born anemic. That's 1 to 2 ml on the third day, and then you have to repeat it on the fifth day as well. You don't have to wait till you wean them, but on the fifth day you have to give it to them again. Piglets, if you're treating anemia in them, you have to now wait and count 1, 2, 3, 4, 5. On the fifth day, you take or you catch the same piglet and give them the iron 2 ml again. You don't have to do it once, and you don't also have to give it to them at all at once by giving them 4 ml at a go. It is wrong to do that. Always go by what is indicated here. There's a reason for that. And also, if you are using it as a preventionary measure, like, it is always recommended, don't let it happen before you go to take drugs or medications for them, so that the anemia doesn't occur at all in your piglet. Now, when you give it to them 2 ml on the third day after they have been given birth to, or they are born. So on the third day, you take your piglets, you start giving them the iron shot, 2 ml to each piglet. And then you have to also repeat it. Okay, you have to repeat the iron on the 21st day. I'm sure you are getting it right. If you give 2 ml on the third day of their life, then you wait 21 days and then you give iron again to the same piglet. That is usually into the weaning age. So it means you are about to wean them. So you give them the 2 ml again on the 21st day to ensure that they get the boost they need to perform better for you. I'm talking about this ml and milligrams and ml. Definitely, that is the dosage I'm talking about. So you just look at the dosage, how much you're supposed to give to each pig or animal you have on your farm. Let's say you didn't feed your sow well, and the sow has not also given birth yet, but it is still with a pregnancy. With this, when it is getting to 2 weeks to farrowing time, note this, 2 weeks to farrowing time, you can correct iron deficiency in both your sow and the piglet by injecting 5 ml 2 weeks before the farrowing time. Yes, that is if you can correct iron deficiency in the sow and the piglet at the same time by injecting 5 ml 2 weeks before the farrowing date. Otherwise, if you miss it and then the piglets are born anemic, that is where you give them 2 ml on the third day of their life, and then you repeat it on the fifth day. That is a treatment. But don't let it get to that stage. Always go by the prevention. That is better for you and it is less costly. So the sow, two weeks to farrowing, you give 5 ml of this iron to it. Most of the times we go to the farm to do this treatment and we don't protect ourselves or the pigs. So these are gloves. You are supposed to wear this. Alright, you're supposed to wear them before you handle your pigs. Other than that, you can also just wash your hands with soap and clean water, wipe it with a clean cloth, and then you can start with the administration. If somebody holds the pig for you, you don't need to restrict this animal. Hold it tight to yourself before you can give the injection. I also want to talk to you about something concerning the syringe you're supposed to use. This is exactly 2 ml syringe, the capacity 2 ml. You get it? So just like this, turn it, pull it out, okay. And once you are drawing the drug or the medicine from the bottle, you're supposed to pull it in order to get the right dosage. Pull it up so the tip of it lands exactly on the 2 ml. Lands exactly on the 2 ml. That is 2 ml you're giving to it. Below it, you have not gotten to the gauge. Above it, you are over the dosage. So right at the 2 ml mark exactly. So mostly, if you want to draw the drug or the medicine from the bottle, you're not supposed to just do it this way. This is wrong, okay? And the reason being that you can end up drawing in air. No, the bottle is not full yet. This is the mark of it. So if you do it this way, you're likely going to draw in air before the drug itself comes in, which is not good. So always make sure you turn the bottle upside down this way, so that all the liquid the air will be up. Then you can insert the needle and draw the right dosage or the right amount of the drug you need, and also try to minimize the air inside or the air bubbles. After you have drawn the medicines into the syringe, all you need to do is to tap it. Once you tap it this way, the air bubbles, instead of being down, they'll come up. If they come up, it's better than them going down, because you don't want to first inject air into the body of your animal. It doesn't need it. So ensure that the air comes up. Then you can gently press it into your animals. Give it to them gently. And looking at this one, you're supposed to give it to your animals via the intramuscular. That is in the muscles, not in the skin, the muscles. So you should pass this first coat of the skin. Press it harder, let it go inside. And then you can gently leave it inside. And also, if you want to inject this, the position and the angle of inclination is very important. This is how you're supposed to give via intramuscular, no matter what the circumstance. Intramuscular, just straight at 90-degree angle like this to the skin of your animal, 90 degrees. Okay, this is it, 90 degrees. Avoid doing this. If you do this, you are likely going to put it in the skin. It will not get to the muscles. And that's why most of the time your pig is not properly vaccinated or treated. So this way is not recommended for intramuscular. And this is not recommended. It should be straight this way. It should be go inside directly and then you deposit it there. After you have done that, all you need to do is then use your finger, massage the area of administration, the site of injection. Just massage it this way. Just massage the site of injection this way, and the drug should be distributed inside for you. You understand? So that is it. You're not supposed to be worried too much about it, especially where you are not able to get a veterinarian to assist you. You need not to worry too much about it. Just go by what I just told you, okay? And you'll be fine to go. And after you have also given the iron to your animals, usually there will be some sort of reactions. So you just observe your piglets, whether they are active or they are still maintaining that kind of dark position after the first day. So you observe them. If they are active, fine, your drug is okay. But if they become weak or they are not being active, then you have to attend to them. And I talked about how to inject, but I didn't talk about the site of injection. So if you want to inject, it is just right behind the ear region, this side of your pig. Okay, this side. And directly, then you inject it there. Alright, so basically that's it. If you go to buy the drug, make sure the animals you want to use to treat, the animals are listed on the drug, the label, and also check for the expiry date. Usually 2 years ahead is always better. And then look at the dosage, how many are supposed to give. Can it be used as treatment or preventive measure? If treatment, how many? If preventive, how many males should you draw? And then look at when again you're supposed to use. There are some of them you just give once and that's all. But with this, you're supposed to give it on the 21st day as a prevention measure. After you have weaned them, you give again. That is it, 21st day. And if you look at the drugs, usually we have withdrawal periods. And what is this withdrawal period they talk about? Withdrawal period is basically the time for which the drug is exhausted completely in the system of the animal. With that, if you consume the animal or take any product from the animal, it's not going to cause harm to you, the human. So usually you see 18 days for meat and then maybe 24 days or 6 days for milk. If it is 18 days for meat, it means after you have injected the animal should not be slaughtered before the 18th day. The animal should be allowed to live to 18 days and above. Then you can slaughter, but then the drug has already been used up in the animal. And if humans take it, it's not going to cause any harm. That is basically what it is. But with iron, usually there's no withdrawal period for iron because once it is injected, it has started mixing with the blood. No need for you to wait for anything again. So basically, that is how we're supposed to go about it. And for you not to have make any injection mistake, always if it is 2 ml, go in for the 2 ml syringe. It's always best so that you don't doubt yourself about how to measure, how to indicate. The syringes, we have them in types. We have the 5cc, a big one of course. And for your piglets, you don't want to get a big one that will cause them pain or open the skin a lot. So you just get something small like this and then be able to draw it in. And also remember, it is a single use only, so you discard after you have used it. Don't wash and keep it back in your first aid kit. No. Once you open it this way, whether you use it or not, don't ever try to use it again. Once it is taken out of the rubber, that is it. You have already used it like that, whether you injected or you didn't inject. Discard it by throwing it away. It's not expensive, just 1 cedi. So you don't have to, because of 1 cedi, you will infect your animal. So just discard it after you have used it. It should be okay. And mind you, piglet, if you're going to buy syringe for piglets, buy the smaller ones always as possible so that you don't give them a lot of wounds. They are already vulnerable. So if you get the big ones and the wound opens a bit, you're going to harm them. And if we have to give the 5 ml, like in the case of the sow, we are supposed to give 5 ml 2 weeks to following. With that, you can go in for the 5 ml straight and then you just throw in the 5 at once and then inject. And one thing is also that sometimes if you want to administer drugs to these animals or your pigs, some of them are being aggressive. They don't want you to get close to them. Just get a restricting cage. Get a cage that you put the pig inside. Okay, with that, the level of movement is limited, and then you can do your administration easily. Otherwise, get people to assist you by handling the pig. Because if you don't let people help you, or you don't grip the pig very firmly, or the animal firmly, and the animal shakes, assuming this syringe is inside the animal, and then you are holding it this way, and then the animal is also shaking, and this syringe, mind you, it can break. If it should break and get remains in the skin of your animal or the body, It's going to be a lot of complications you will encounter on the farm. So always ensure that the animal is firmly gripped to avoid unnecessary movement. And then you can gently press it and release it into it. Whilst you are pressing, if the animal starts being aggressive and shaking its body, the only thing you need to do is to release your hand off this one so that this will be attached to its body. If you try to hold it, the needle might break and it will be left inside the body, which you don't want it to happen. So always ensure your animal is firmly gripped before you do any type of injection into it. It is okay if you inject your animals with this iron and then you see the iron coming out. It's okay. Like you see that red or dark brown color coming out, it's okay. It has entered the animal already. Just ensure that, as I said, it is 90 degrees and you have rubbed the area after you have injected, massaging it for it to get distributed. Small amount of it will definitely come out and it will look like a spiked blood. It's okay for you. I think this company is taking over the drug industry, Jubali Agrotech.